Okay, so we are on record, and from the Chatham Rotary Club, we would like to welcome everybody, and a special shout out to our friend Lori Marshall, who is a learner's healthcare champion. So congratulations to you, Lori, on that. I was glad to see that many people chimed in to get the vote in there for you. So very happy that you're a proud member of the Chatham Rotary Club as well. Our first thing on our agenda is our happy thoughts, and I think we have many. I'm going to jump right over to Karen Kirkwood-White, if you would, Karen.
Sure. Since you reminded me 5 minutes ago, I'm very pleased to let everybody know that as a member of the Ride Don't Hide committee, I got confirmation that Tech Savvy is going to be a $1,000 sponsor for this year's event. So very happy about that.
Good.
And the other thing on the Ride Don't Hide is the Rotary Clubs of Chatham, Chatham Kent, are getting together and working on a sponsorship from all the clubs of Chatham Kent. So I think that gets a lot of backing, and I already see on our team membership it's starting to grow a bit. So that's wonderful. The more the merrier, for sure. Anybody else with a happy thought? Just raise your hand and we'll get you going. Rick Bednarik, please.
Okay, I've got a little vignette dealing with the 100-year anniversary. So we're talking about things that sort of occupied directors and presidents and committees over the last 100 years. And the major 3 or 4. This birthdays and anniversaries, it doesn't happen to be one of those. However, it is important. It came up very early in the game. And one of the features of it is a little gift that we give when we had face-to-face meetings to everybody. And I happened to find one of those. I happen to be storing the console in my wine cellar. And I found in the console this wheel. And you can see it's sort of warped and it's sort of discolored. It does say on it, let's see, this is fresh chocolate, fresh product. To ensure its quality and flavor, this product should be consumed within 2 weeks. Well, yes, but this is still useful. With that concave part in it, you can use it as a change. Yeah. Okay, but anniversaries. This happens to be one birthday is the Queen's birthday today. So if you happen to have a glass, raise it to Her Majesty. She's 95 years old today. This was the 30th anniversary of a district conference meeting held in Chatham, 1991, at the Wheels Inn. We'll ask a question now. Does anybody know who the president was that year, 1991, April? Guesses?
We'll try Allison.
That would be my dad, I think.
Yes, you're right. You're the winner. Colonel Jack Loosma, who was an astronaut on Apollo 9, 10, and 13 missions, was the guest speaker. Another feature was Barry Fraser was chairman of the Rotary Environmental Committee. And he took a tour out to the McNaughton Avenues Public School, which had a huge planting there, a huge project in cooperation with the Environmental Partners Fund. And the amount of money that was put into planning in that. And actually, when I came across that, I took a walk out there about a week ago, and we should probably go back and have a look at that when things green up and see of those dozens and dozens of plantings that went on. A lot of it Carolinian forest stuff is still alive. Another feature was, of course, ubiquitous in Rotary was the Ladies program. Departure by bus from Wheels Lobby to the Country View Golf Club, not for golf, but for a luncheon and fashion show, followed by shopping at the downtown Chatham Center. Yep.
Thank you, Rick.
I think
Tom Story.
I think Barry would tell you that it rained.
Yeah. I was gonna just say, I remember that event quite clearly, unlike pretty well any other event in my life. And I have to mention, that was the start of our environmental club. And I had to get Barry to chair it, although he was strongly opposed to being the least bit involved. But he ran that. And I also have to recognize Andy, who arranged for the funding for much of that, those trees that were planted that year. And we had what, Barry?
About
7,
5,000.
8, 9 schools that we did.
Yeah, over the course of the 2 years, 91 and 92, we
Yeah.
planned on 22 school properties,
Yeah.
5,000 trees.
Oh,
Yes,
So
I remember the funding, and for the younger members, it was a kind of a lucky thing, because I ran into the right person at a convention in Toronto. It was the Federation of Agriculture Convention, and that I asked the lady who were the directors on this board that was doing it, and I realized the influence that she had. So we went and had a lunch, and I bought her lunch, and that lunch brought the Rotary Club, I think it was $56,000, something like that. So, and there was no doubt about that. There was no doubt that she influenced it. No, the money was going to be spent on something in Ottawa for the wildlife, and they divided it up, and we got a share of it. So that was probably the best return on a lunch that I ever got.
No doubt about it. I think her last name was Stephenson.
I'm trying to think. Stewartson.
Stewardson? I said Stephenson. Yeah, Stewardson. Close.
From Lambton County, and it's one of those things. I had been at the little booth, and I stepped back, and I saw her name was Donna. Yeah, Donna Stewartson. And I said, well, this is what it's funny. This girl I just met at the booth, and she says, well, you should contact the board members. And I said, well, she's going to send me a list of the board members. And Donna says, well, I'm on the board. So I said, we're having lunch, and it paid off. She actually came to the opening that we had for it.
Oh, that's great. So as we're entering our 100 years, we'll keep, Rick has been doing a lot of digging, so we're going to have a minute or two for Rick to kind of tell us what he has found in the archives, because now I'm not too sure. I thought it was brown chocolate, but Rick was showing us it looked to be more like white chocolate now. And don't eat it, Rick.
Muddy chocolate.
Any other happy thoughts before we move on here? I'll send out a quick welcome to Tina Hodgson. Tina is possibly entertaining membership with Chatham Rotary. So just hang in there, Tina, and you'll have to put up with a little bit of banter back and forth. But what we're all here for is to listen to our speaker. And of course, any connection that we have with each other, it's great. I think it's for our mental health. So we'll just keep going on with this while we have to keep our Zooms in the going. Next, last call on happy thoughts. We'll have a minute or two as we're signing off.
I just wanted to say Les is doing a great job leading us in the bingo. And I think it's awesome that even though we're not able to meet for lunches, we're still doing bingo and making a lot of money that we're able to fundraise there and give out to the community. So way to go, Les. Where is Les? Is he here? No, there he is. Yeah.
Right,
Way to go,
beside
Les.
the washer, the dryer there.
You're doing a great job. You and Brett are doing a tremendous job leading bingo. So thank you.
Well, it's a team effort. Every week there's 5 people that help out, and then during the week you got all the bingo bucket brigade, and it's a total team effort.
And I'll talk to you about that with the club news because I got to put a message out for a vote coming up shortly. Moving on from that, we're going to jump into our birthdays and anniversaries. So again, we do it for the month because we're not sure who all happens to make it here. And first on the birthday list for April 1 was Andy Watson. And we also have Diane McGuigan. Hers was last week. And Colin McGregor, his is tomorrow. So happy birthday to that crowd.
My dad just turned 85 today too. So
85, great.
Oh.
Yeah.
He's a good looking 85, that's for sure.
you know, you got his email. Feel free to email him.
Look what you missed, Colin. I'll save this for you, Colin.
Oh, yeah, you get the chocolate, Colin.
Thanks, Rick. I'll take it next Tuesday at bingo.
And our anniversaries, we have both Tom Story and Jerry Bellinger for the 38 years in April. Janet McGuigan Kelly, welcome. 27 years. You're just behind those other guys a little bit. Paul Mayran was 22 years. Gordon Jane Fry were 7 years. Jennifer and Tony Hill, 8 years. And Ed Robbins has 21 years. So welcome to all of those and congratulations for many, many, many years of service. And we're looking forward to many more. So at this time, I'm going to ask Lori Marshall if she would take over and give us an introduction of our guest speaker.
Thank you. So when Jennifer approached me and said, do you have anybody who could speak to us about mental health and addictions? I immediately thought of Alan Stevenson, who is not only the CEO of Chatham, the Lambton Kent Community Mental Health Association, but also our Vice President of Mental Health and Addictions at Chatham Kent Health Alliance. And through the last number of years, I've worked with Alan on several initiatives, and I've come to know him as not only someone who is well-informed in this particular area, very passionate about our communities and how it is that we need to address the needs of our communities, and also just a wonderful person to work alongside. So I know everybody today is going to enjoy hearing from him on this subject that I know is of concern to everyone. So with that, Alan, over to you.
Thank you, Lori, for that kind introduction, and thank you, Rotarians, for this wonderful opportunity to join you today. It's lovely to see some familiar faces, some old friends, and some people that I've had the good fortune to have worked with over many years. It's great to see you. So the first thing I'd like to do is just to thank you and acknowledge. You talked at the very beginning about Ride Don't Hide and the commitment that Chatham Kent Rotary has made right away. Talking with my team at CMHA, you've really given us a shot in the arm with your enthusiasm and your support for that important event. And it goes without saying that we're very thankful, both from CKHA as well as from CMHA, for your long-standing leadership and commitment to mental health in terms of your charitable giving. I know that Rotary internationally is embracing increasingly mental health, but quite frankly, to my knowledge, this particular club has been the bulwark on that. Really led the charge. So thank you for that. I am going to share my screen. I do have a slide deck, and I will just bear with me for just a second. While I get the slide deck up. Can you give me a thumbs up to let me know if you can see my screen? Yes, excellent, thank you. So as Lori introduced, I am the CEO of CMHA Lambton Kent, as well as the VP Mental Health and Addictions for Chatham Kent Health Alliance. I've been in that dual role now for about 9 months. And I just want to highlight that for a second, because I think what we have here in Chatham is a really unique opportunity to create a system of mental health and addictions care that really overcomes one of the biggest challenges in our healthcare system, and that is silos. The fact that organizations work very much independently and don't often enough do the kind of collaboration that is necessary really to improve quality of care from end to end. And with our collaboration here in Chatham Kent, which is in many ways leading the province, we have the opportunity to really change that. As I go ahead, I will acknowledge that I only learned about a half an hour ago that Taylor Kluche from CMHA, one of my team members, spoke to you last week. And I understand actually that she may have used some of the same slides that I'm going to use. So I apologize for the duplication, and I'm not sure which slides they are that are the same. But I will try. I kind of got an assumption around that, and I'll try to move through those ones fairly quickly. So just to build the background, you know, there's common misconception that mental illness is not common, and in fact, it is. Mental health problems and mental illnesses are very common, with 1 in 5 Canadians experience a mental health issue this year. And I have to qualify that to say that that's pre-pandemic data. We anticipate that, and the evidence is bearing itself out, that the likelihood of people experiencing mental illness is much higher in the pandemic and going forward. We know that those impacts will play themselves out well after we have control of the virus. We also want to just acknowledge that that there's a lot of misunderstanding, often promoted by popular media, about dangerousness. While there are people who experience mental health problems that are dangerous, they're no more than in the general population. And in fact, the evidence indicates that people with mental illness are much more likely to be victimized than they are to be perpetrators of violence. And most importantly, many people who experience mental illness, the vast majority are able to lead full and productive lives, and particularly with access to good care and treatment. And when I say mental illness, I also include addictions in that. When I talk about mental illness, I certainly include, and in the one out of 5, includes people with substance use disorders. So a little bit about the impact of COVID on the mental health of Ontarians and Canadians generally. Since the beginning of COVID, both the Alliance and CMHA have continued to operate services without interruptions. In many cases, we did pivot to largely virtual services, but not exclusively virtual services. Our doors have been open throughout the entire time. Increasingly, we've seen over time that as the needs of people have changed, and our ability to really get a good sense of how people are coping and doing, we've had to increase the face-to-face contact and augment with virtual. Of course, as the waves of the pandemic have ebbed and flowed, and of course we know that they're at a particularly dangerous height now, we have had to again reevaluate and shift again increasingly to virtual, but not exclusively. And we think it's a very important message that because quite honestly, in a community like Chatham Kent, virtual care is not really that accessible for many people that have limited or no internet access, for example, and particularly where there is, and I'm sure you've seen on your Zoom calls, where people who live in rural and remote areas have very, very disrupted internet access. So ensuring that those resources are in place, both virtually as well as in person, has been critical to ensuring that we can care for people. Initially in COVID, we did see a reduction in demand, and we attributed that, and the feedback we've heard from people is that at the very beginning, and if you think back, we all sort of felt this is going to be a shorter term situation. We really felt we needed to hunker down. People tried to hunker down, tried to get through it on their own. But as the situation continued to draw out, those coping mechanisms became less and less effective, and people needed to reach out for care. And so ever since really about June, we have seen a demand for both mental health and addiction services beyond what we had ever seen before, and we anticipate that will continue. This, I think, I'm not sure if you've seen this, but I think this is the most important slide in my entire slide deck. And this contemplates waves of the pandemic, but not waves in the sense that we most often hear about, not sort of wave of high transmission, high infection rate that we've talked about being in the third wave, but actually the waves or the different types of impact on the overall health and well-being of, and this is actually not a Canadian slide, this is an American slide, but of everyone. And that is acknowledging that the pandemic in this, what is in sort of a purple color in the first wave, and that's the first, second, and third wave that we're currently in, has immediate impact on mortality. So the illness itself causes, the virus itself causes significant illness and death. In the second wave is really about the delayed procedures and access to care that's been created by the pandemic. So people were and still are less likely to be able to get primary care, for example. They're not getting care. They may have had canceled or delayed surgeries. The third wave, and I'll note that there's great importance to the fact that in the first wave, the arc comes back down. In the second wave, the arc comes back down. In the third wave, so the third wave being the impact on chronic conditions. So, for example, the fact that I have a great friend who's a physiotherapist, and she talks about the impact of not getting follow-up physiotherapy after a joint replacement, how that will impede and impact on people's mobility for a long period of time, and potentially they won't realize the benefits, the full benefits of that joint replacement. So that's sort of the fourth wave, the third wave, and then the fourth wave, and we don't see the arc dropping, and we see the trajectory continuing on well into the future, and that's the mental health impact of COVID-19. And the mental health impact that we all to some degree experience is in areas of prolonged stress, which becomes distress, which becomes burnout, which can become anxiety and depression. And we know we don't have precedents. We know that there are precedents from a SARS, for example, that occurred a decade ago, but that was different still in the sense that it was relatively short term. It was relatively contained. It didn't have the global or regional or national impact that COVID does, and we weren't really at that time questioning what our world is going to be like in the future, and we're all sort of questioning that now. So those impacts, those mental health impacts, and when I say mental health, I include substance use disorders again, are likely to be with us for at least a generation to come. So what are we seeing locally? We're seeing particularly, and I don't think this will become as a surprise to anybody, isolation, loneliness, increased anxiety, depression, grief, loss, obviously financial distress as people people particularly have not been able to work and are really struggling financially, increased substance use and abuse. We're seeing, and this is I think quite a concerning thing, we're seeing evidence of increased eating disorders too. And those are things that, again, will have a very long impact. And of course, we are all aware of increased crisis calls and domestic violence. I'm going to talk a little bit about what we've learned over polling in Ontario. There's been a number of different polls undertaken by a number of different polling organizations for a number of different thought leaders. CMHA is one of them, and it's just the one that I'm most familiar with. Quite frankly, they all say the same things. So this is representative of what you would see in polling both across Ontario as well as nationally. And I think this summarizes it so we've done in CMHA, we've done 3 sets of polls beginning in the spring of 2020, in the summer and in the winter of 2021. That's the most recent poll of December of 2021. And what we're seeing is early on, people were saying, for the most part, 52% were saying that their mental health and well-being, they identified as good or very good. That's dropped down to 35% within the course of 9 months of the pandemic. We anticipate, the other thing, and this is very nuanced, but one of the questions was in this survey or this polling questionnaire indicated that most people acknowledge that the longer the pandemic drags on, the greater the impact on their mental well-being would be, and the more likely it would be that they would experience poor mental health. Ontarians are reporting stress, and so stress and anxiety are the highest reported impact of COVID-19. And anecdotally, I can tell you that people that I speak to most often speak about anxiety, about high stress, particularly about stress without sort of relief, and just a prolonged stress that has led to feeling overwhelmed very often. So 36% report high or very high stress, and 35% report high or very high anxiety. We're also seeing, and again, increasing depression from the very beginning ranked in terms of self-reporting, and this is consistent with all of the different pollsters, was lower. Depression rates were lower than anxiety, but we are seeing depression increasing from up to 17% in December from 13% in April. And 36% of Ontarians are now saying that they are often feeling depressed or very often, which is very, very concerning as well. The good news is that only, it's not the right word, 35% of Ontarians have said that it is difficult to access mental health services. However, that's an improvement over the earlier indicators, and that's because, or rather the earlier results, and that's because pretty consistently mental health organizations like CKHA, like CMHA, have sort of rallied and provided public service announcements and exposure in the media to let the public know that services are available, that it is normal, it's perfectly human to experience difficulty during times of COVID and to access care if you need it. And as a result, we have seen that people are saying that when they receive mental health services, it helps. So about 70%. But again, people are concerned about the future and the long-term impact, and that their mental health will decline if as the pandemic increases, or sorry, goes on. So I know that when invited, you were very interested in substance abuse as well, and so I'll talk more now about substance use and substance abuse. And not surprisingly, and consistent with the other reports, we are seeing that Ontarians are using more alcohol and other substances, with 27% of Ontarians reporting increased substance use by December, as opposed to 21% in April. And of course, that's very concerning. People report that they are using substances to cope. So again, it's the underlying concern of mental health problems and relying on substances as coping mechanisms that is concerning. However, 32% of Ontarians report that their consumption hasn't changed, and in fact, 13% report that their consumption has declined. One of the, I'm going to talk about a really important innovation in addictions care, and that's the advent of addictions medicine. So I'm a 30-plus year career mental health professional. I have less time in the addictions world, but certainly aware and more involved in the addictions world in the last decade. And the reason that I say that this is one of the most important innovations is with the advancement of addictions medicine, and that's practiced here in Chatham Kent through the Rapid Access to Addictions Medicine, or RAM clinic, we've seen a shift, certainly from traditional models of addictions treatment, to engage more physical health care, as well as more multidisciplinary, including medical care, and the use of replacement therapy as a very appropriate and well-managed alternative to substance use. And so we've had the RAM clinic here in Chatham Kent, operated by CKHA, since 2019-20, about mid-year, and we've incrementally been able to expand that clinic based on some additional funding that we've received from Ontario Health, or the Ministry of Health and Long-Term Care, specific to that program. And we've seen a real increase in the utilization, as you can see by the numbers, really a tripling year over year of visits and utilization, a doubling of unique clients to this program. Rapid access to addictions medicine is a low barrier, meaning you don't need to be referred. Anybody can access it. Addictions treatment that is a multidisciplinary approach, including counseling, so dealing with the psychosocial issues or the mental health issues, as well as medical treatment to reduce or replace substance use. And it is very much a tailored experience. So it is based on the individual's goals to either reduce or eliminate substance use altogether. And it is a program that walks along the journey with people, so that it very often people who are contemplating getting off or stopping using substances will have incremental goals to get there. And this is a program that enables people to achieve those incremental goals with supports that are tailored to that, if I can use the term, phase of change that they are in. And so it does adapt and evolve as people walk through their own recovery from substance use. I'm very excited. I think it's actually one of the most necessary evolutions of our mental health and addiction system to come in the last decade. And I can see it growing going forward. So a little bit about opioid use, because I understand you're very interested in that. And I'm just gonna, this is a busy slide. It talks about opioid use in Chatham Kent over January 2019 to February 2021, with a number of different indicators, including calls to the EMS, visits to the emergency department by Chatham Kent residents and others, suspected drug-related deaths, and confirmed opioid-related deaths. And you will see that the red is the EMS calls, and you see that there's some big spikes in that, and that has certainly made the news. I think that's what has drawn a lot of people's attention to opioid related overdoses or suspected overdoses. What I think is important to note about this is actually quite you'll see first that it's not a static line. None of them are static lines, except for deaths are fairly static with some notable increases. What I'd like to draw your attention to perhaps alleviate maybe concerns is, if you look at the entire province, the data is very similar. Big concern that overall across the province, across Canada, opioid related overdoses have increased significantly to the point of having been called the opioid crisis. But our data in Chatham Kent is not significantly different than what you would experience in other parts of the province. And so there has been, I think, a misconception that this is a particularly high overdose area. And I think that is, I just like to challenge that conception. The one thing that I will acknowledge, though, is that historically we have had high prescription rates in Erie, St. Clair, and in Chatham Kent included, for opioid painkillers. And we have done, I think the whole healthcare and medical community has done, I think, significant work to try and stem that. I don't have a slide on this, but one of the really important projects that CKHA has been involved in, along with others in the medical community, is the Choosing Wisely program, which is really about educating prescribers about options other than opioid to stem the utilization or the because quite frankly, people did get into opioid abuse in the past because of overprescription. To stem that overprescription and provide alternatives to opioid prescriptions. So, I apologize, probably should have had this slide up prior to the last one. This is longitudinally, so this actually describes a longer period of time from 2005 to 2019. Again, ED visits, hospitalizations, and deaths, and you'll see that that certainly Deaths have increased, particularly since 2010, but have remained relatively consistent since 2010. But we have seen a significant increase in ED visits, overdoses since 2016. Some of the other things that in RAM and others, primary care, all of our addictions programs and all of our mental health programs play in terms of preventing overdoses is education for people who are using opioids, as well as the distribution of naloxone kits. So the ability to self-administer or administer to a friend or colleague or acquaintance for that matter, who may be using and may be experiencing an overdose. Naloxone then will prevent the ongoing, stop the overdose from occurring. So I'm going to wrap up and certainly open to questions. I hope that I've covered off the information you were looking for, but I will just wrap up with drawing your attention and asking you for your support to a campaign that's currently underway called Everything Is Not Okay. Everything Is Not Okay. The website being everythingisnotok.ca. This is a partnership between CMHA, between psychiatric hospitals, the association, AMHO, the Associated Mental Health and Addictions Organizations, which CKHA is a part of as well as Children's Mental Health Ontario, to really draw support for our advocacy for investment in mental health resources, mental health and addictions resources across the province, particularly in relation to the impact of COVID-19. I haven't said as yet that we are seeing both at CKHA and CMHA and across the province. I'm in contact weekly with partners, particularly in our region. All of us are, quite frankly, overwhelmed with demand. We have seen at CKHA increases in visits to the emergency department, as well as increases in admissions. We're seeing longer wait times, and that's the same for services in the community. This advocacy campaign really focuses on bringing public support, more people getting behind the rallying cry of invest in making sure that mental health and addiction services are accessible to people when they need them. And so our objectives are consistently across the province, no matter where you are, to have access faster, so that there are reduced wait times, easier access so that you don't have to work so hard to self-navigate, but to have access. And I think, just speaking about Chatham Kent, one of the advantages we have of our collaboration is we have improved access to care. We do have fewer hoops that you have to jump through because we coordinate, and then transparency to ensure that we as a sector are making ourselves are accountable and making sure that the public knows that they are getting good quality care. So with that, I'll say thank you for your attention. I hope that I've provided you with the information you were hoping for, and I'm happy to take questions. I'll just stop sharing my screen so that I can see you again.
Great. So thank you very much, Alan. Really do appreciate this. As you know, mental health has always been important to this club, and I think we are quite proud of the fact that we do a lot to work along these lines. I will open it up for any questions. If you can raise your hand. I'm going to start with Colin, please.
Yeah, Alan, on the graph for the page 13, it showed EMS visits and other factors, but I saw there was a big spike, in visits and all the factors last spring, and I can understand why, because I would think maybe with COVID, but it also happened in 2019. There was a big spike in the spring of 2019. So what is it with spring?
So I actually think that has more to do with supply. Certainly the 2020 spike was related in part to COVID, but it also has to do with supply. I have a friend actually, and it works for through the Sarnia police services in the drug squad, and this is again anecdotal, but he talked to me about when there is bad supply, so particularly dangerous supply. There are people, hardcore drug users, who actually, when the police send out a warning, that's when they go get with gusto to get as much supply as they possibly can. So unfortunately, supply is a big concern. There is a group as well, Provincially, and again, CMHA is a part of this group that is advocating for safer supply. And there's evidence from other jurisdictions that safe supply is one of the best protectors of preventers of overdose. It's kind of controversial and certainly fraught with ethical questions, but to respond, I think it's largely supply.
Thank you, Alan. Karen, please.
Thank you very much, Alan, for the presentation. I'm pleased to hear that the crisis isn't as much of a crisis as what some people might think it is, but it's still very serious. And I'm wondering if you have any comments to make about the whole issue of harm reduction and safe injection sites. Putting you on the spot, sorry, but
you're not putting me on the spot at all, Karen. Thank you.
Okay.
You won't be surprised to know that I am an advocate of harm reduction, much like the safer supply comments that I just made. Right. Safe injection sites, I think, are one really good opportunity, like safer supply. It's actually part of the same. It's two sides of the same coin, isn't it?
Right.
For harm reduction, absolutely. And on that, in my experience, when you provide those opportunities for people, you're not just providing them with that moment in time, that safe injection, you're also providing them with the opportunity to engage. And that engagement, trust building, that can be the beginning of a harm reduction journey. That's the key. I know that there's ethical questions around it. I know that there's certainly strong opinions and positions on it. But I think it's an important conversation to really understand the risk to morbidity, the risk to death, and the loss of life and the impact that has on other people that survive, versus the ethical questions. Hope I answered your question.
Yeah, it's one of those things where, in the housing areas, we're fighting NIMBYism. And in this particular issue, we're fighting against those that maybe just don't understand and need to be educated about the positive aspects of things that a lot of people don't understand. So I'm hoping that we can do some more education about harm reduction and what it means, and the whole issue of building trusting relationships with the people that we're trying to help. Thank you.
Thank you, Karen. Any other questions? Dave McGuire.
I just wonder now, is there any particular age group in the stress and anxiety area? Is it teenagers, or is it young parents with daycare issues, or is it parents with teenagers or us grandparents?
I think it's all of the above, and thank you for that question as well. The experience is very different depending on age and stage and networks. You know, what I have heard and what I continue to hear is, you know, if your circumstances were that you were isolated before, you're just so much more isolated now. I also hear from young people that and I'm a father of a teenager and speak from that perspective. Their goals seem to have been cut off. You know, their expectations of their next steps, their next stages, they're just not sure. So that stress is there, and of course, young families trying to figure out how to deal with the education system. I know, you know, speaking with, and this bore itself out in the surveys as well, and it's consistent with the literature and inconsistent with what we see in clinical practice. And I'm sure consistent with the conversations you have with your friends and families, having to figure out how to do math again to support your kids who are doing virtual learning, for example. Trying to figure out how to do your own work from home when you don't have adequate bandwidth to deal with your kids working on schoolwork at home as well. All of these stressors that are they don't seem to be ending. That is you know, all huge concerns. One of the ones that I'm though most concerned about, so I have a lot of experience working in seniors' mental health, and it is an area that you know, we have some great capacity here in Chatham Kent, but across Ontario there has been not enough attention to seniors' mental health. And what we see, you know, trends over time is that very often we'll get referrals from adult family members following holidays because they may have not seen or had spent as much time with their senior family member prior to that, but over the holiday, there's a lot more contact, and they become very aware of the decline in the senior family member, and so they reach out for help and services. Well, we've been lacking that. That trend has sort of flatlined. We haven't had those referrals, but we know, and I can tell you from, you know, I have a mom who's 91 years old living alone. The declines are occurring, and they're occurring more rapidly because of isolation and because of lack of structure. And so we anticipate that we are going to see a really significant demand, like a surge in seniors' mental health needs when things open up more again. And we know that, you know, one of the most challenging sort of psychosocial issues for seniors is isolation and the impact that has on their well-being. So that's probably one of those youth families with dealing with the stress of managing their family and their kids, and seniors. Those are my big concerns. Thanks for the great question.
Thank you, Alan. Thanks, David. Any other questions at this time? Janet McGuigan, Kelly.
Thank you, Brett. Alan, what advice do you have for people when you're approached on the street, which I see more often lately, for financial help, and you believe the person is having an addiction issues? I've seen it twice just recently where I thought maybe the person was in some kind of mental distress, but I didn't know, should I be calling the police or calling the, you know, intervening in some way or not intervening? I find that we're going to face that probably more and more.
Janet, thank you for that question. I'm not really prepared for it.
Okay.
I mean, that's a very personal choice and response, I think. Obviously, I want to ensure your safety. That would be if you were concerned that somebody may be high, and you may be concerned about their judgment. Then I would, just manage that politely to ensure your safety. Karen, do you have thoughts on this?
Yes. I'm just thinking that a lot of these folks, Janet, that you might be running into are well known to the volunteers who work with Rock Missions. And I know that Renee, who is in charge of the organization right now, has a number that people can call if they want to identify. There's an individual on the corner of, walk and don't walk, and he or she may be known to someone from Rock Missions. I'm going to be speaking with Renee in the morning, and I'll bring this up with her and ask the same question and see if she's wanting to, share her phone number or somebody's phone number. Because often it's a relationship that already exists with one of the volunteers, a very trusting relationship that has been established over 12 to 18 months. And often if the Rock volunteers know where these people are, they will go and find out, what kind of help they might need. So I'll raise that issue tomorrow morning.
Thanks, Karen.
Thanks,
Thanks,
Karen.
Karen, for jumping in. I appreciate that. And I just would add that if you haven't already, I would ask, just consider inviting Rock to come and speak at one of your meetings. They're doing amazing work here in Chatham Kent.
Any other questions for Alan?
I got one.
Alan, I just had one inquiry. Do you think with the current COVID situation, has that sort of jumped in front of the previous opioid situation?
Sorry, could you jump
Like,
in front?
has COVID and all of our interest is leaning more towards the COVID pandemic, has that overshadowed now the opioids arrangement that was kind of a little more in the forefront before?
Oh, okay. You mean sort of it's taken the attention away from.
Yeah.
Yeah, I suspect it has. I know that in most areas of healthcare we are quite preoccupied with COVID. I think we are turning our attention though, because we are in a bit of a crisis with respect to mental health capacity, mental health and addictions capacity. We are turning our attention more back to the longer term impact. Again, that on that graph, sort of the fourth wave, the long term impact of mental health and addiction. But it's certainly possible that the focus on, I mean, if you look at the news, it's 75% about COVID has been for the last year, right?
Yeah. Great. Then I just want to thank you on behalf of the Chatham Rotary Club. We really appreciate hearing anything, and I would tend to say that it was a different presentation pretty much entirely than what Taylor gave us last week. And I'm very happy that the Rotary Club has partnered up with CMHA, and I think there was maybe that little bit of a push to get Ride Don't Hide on a little bit bigger scale, or for sure that it was going through for this year. So we're building our teams. I see a couple of the other clubs within Chatham Kent Rotary clubs are building teams to support the event. So very, very pleased with that. So thank you very much. And just Lori's off screen just now, but maybe she can hear us. So we just want to again say congratulations to Lori Marshall on being a learner's healthcare champion. I think that was wonderful news that we found out. So next week, moving on with other club information, we will have, correct me if I'm wrong, Jennifer, Marianne Wilson from CK Pride will be next week. And the other things coming up, we just attended the April 17 Back to the Basics with District 6380. And from our club, we had Jennifer, Peter, Barry, Sparky, and Brett were all in attendance to that event. We are postponing our Great Lakes watershed cleanup and Chatham Kent pitch-in. We were going to do it this weekend coming. Well, right now you can't even get to the ground, but I'm sure that's going to change. However, putting a group out together into either the park or the eco trail is probably not the best idea currently. So we'll just back that cleanup into later May is the plan. The other thing, I'm going to send out an email to the club. We will have a vote coming up when we have a large expenditure of money. We have to get the approval. We have purchased the new set of bingo tickets, and because we had to more or less go for almost a 2-year supply of tickets, it put it to slightly over $11,000, of which we have those funds sitting in the bingo account, and we're going to need to get club approval for that. The other project that will probably be coming up is got to be run by the 100th committee with regard to our amounts that we're going to give to the high school students. Rick Bednarik came up with a great idea that we are doing the 25 students, so 5 students in each of the 5 high schools. But if we did that on a 4-year program, there's 100, and that kind of gives us the 100 things of Rotary. So it kind of blends in there. And the direction will probably be to use funds from our Riverview Bingo account. With regard to that, it kind of helps it so that Riverview have us wanting to show our expenditures and things like that. What better way to spend it than on the youth? So keep an eye on the Ride Don't Hide campaign with CMHA, and we'll keep putting a push on every week to join the team. And when you go in, join the team under Rotary Club of Chatham. And I believe that's all. Does anybody have anything they want to get out to the club before we bring Julia in? No, so I'll call the meeting adjourned, and I'll ask Julia to play us out, and Andy's going to show us that beautiful yard of his.